You ready to do it?
I'm ready.
Okay, here we go. Oh, let me make sure I turn on my thing. Okay. So 5, 4, 3, 2, and 1. All right, folks, welcome back to the podcast. Very excited to have as my guest today, Dr. Robyn Miller. Robyn, welcome.
Thanks so much for having me.
Awesome. So Robyn is a licensed clinical psychologist and the founder of TheraClosure, the first therapist professional executor service. Robyn has been in private practice in Bethesda, Maryland since 2002. She received a BA in child study from Tufts and a Ph.D. in clinical psychology from the University of Rochester. She completed a pre-doc internship at Harvard Medical School, Massachusetts Mental Health Center, and a postdoc fellowship at Harvard University Health Services. In over 20 years of clinical practice, Robyn has provided training, supervision, coverage, and professional will and practice executor consultation and services, and she's written on the topic. Awesome. Thanks so much for being here. And before we dive in, I'm really excited to dive in because I know very little about what we're going to be diving into today. But before we do, share with the listeners where you're from originally and where you are currently.
Sure. I am from nearby Bethesda, Maryland, and found my way back here after a lot of time, in other places, and have been back here practicing for almost 25 years. So,
Awesome.
yeah.
All right. So let's move into the topic of today. But before we do, how did you get into this field broadly in the first place?
Sure. Well, when I was 12, I said I wanted to be Chief Justice of the Supreme Court, and that didn't happen. So by the time I was in college, I was very curious about how we came to be who we are, and went into child study, and from there went into psychology and thought I would be a professor, but then loved the work of psychotherapy, and so moved straight from there into this art and science of connecting with people and trying to help them kind of get to the heart of what's going on with them and what they want.
You mentioned becoming a chief justice. Did you like pursue that, or was that just some whim thing here?
Yeah, no, that was my 12-year-old self. When you asked how did
Okay.
I get here, it's like, I don't know. I don't
Yeah.
know.
Yeah. Yeah. Yeah.
We think we're gonna go when we're kids.
Well, yeah. I mean, it's really interesting because a lot of therapists in this field, there are kind of breadcrumbs that you can follow. They have that innate ability, need, want to connect with people or listen to people. So you start to pursue this. You went to school, you got your degree. What was it about? Let's go back to when you first started seeing clients, even in your training. What was it about that interaction? You mentioned finding out like what's going on. Talk to us about that.
Yeah. I just love kind of that electric experience when you are really looking at someone and they are looking at you and they want to be seen, or even when they don't want to be seen. Some of my most favorite people to work with are people who initially did not want to be seen and kind of put
Mhm.
their hands up, but then, really just finding a way to see each other in the room, and being, I think, my most authentic self in the room with people is a really nice experience for me to be there in a way that I think sometimes is more vulnerable than I'm able to be in my regular life,
Mhm.
and it allows for kind of a really special way of connecting, and I think that gives people a taste of intimacy, or a kind of way of relating that can be very healing and very powerful.
And to get to that point where you understand the importance of being your authentic self, right? I mean, was that a no-brainer for you? Did you just ease into that? Or for many of us, I mean, for a lot of us, it's hard to be our authentic selves, even for therapists. What was that learning process like for you? And how did
Yeah.
you realize that that was key and elemental to the work?
Yeah, it's an interesting question. I mean, certainly my own experiences over time with therapy and how important and meaningful it's been in my life, and that way of relating, I think, informed a lot of what I do and how I sit with people. But I think definitely for a long time, I was maybe a little more rigid around my way of sitting, more formal, maybe boundaried, and I still consider myself pretty conservative as far as boundaries go, but there's a difference in sort of being really open about how I'm feeling and what's happening in the moment with people, and
Mm-hmm.
that's what I really, cherish.
People connect with that. We need a human being. I've told this story before, but recently, like a year and a half ago, I wanted to get back into therapy. I just moved here to Bend from Oakland, and I reached out to my therapist. She was no longer seeing anybody. But she had referrals, so 3 referrals. I called them all, and I'm sure they were all competent, but one of them in particular spent the whole time telling me about the modality and that they were going to use, and this was theirs. And I was like, I need a human being who, you know what I'm saying? I don't need to know your personal intimate details, but what you're talking about is what I feel a lot of us need. And it's oftentimes the exact opposite. I mean, of what people experience when they're traumatized, right? They're not seen, they're not respected, they're not heard. But anyway, I love it. Okay, so you start to get into this work. Talk to us about this whole specialization that you you work in, and when did that become on your radar?
So it was a big surprise, and it happened about 6 years ago when my very closest therapist friend and supervision partner, who we had met weekly for 17 years,
Oh my God.
a long
Wow.
time,
Yeah.
she suddenly had a terminal illness, that went very, very rapidly,
Oh.
and I stepped in for her practice and for her. And through the course of that very painful and tragic circumstance, I learned so much about what it takes and realized that in our training, we are never really prepared for that. What is there is very superficial and administratively focused.
Hmm.
Might here make a will. It's your professional ethical duty to
Hmm.
plan for the well-being of your patients in the event of an incapacitation or death, or plan for what happens to the confidentiality of your medical records. And it's prescribed, name someone and, sign on the dotted line. And I think that's as far as people really ever think about it, if they think that far, which I think most don't. I did a survey recently, and 31% said that they have a professional will, but I think that was kind of a skewed pool. I think it's much lower than
Hmm.
that even. So I learned about what it takes to do the job, what's required. I wrote a paper about it because it really was the most gut-wrenching experience for me, having to grieve my friend and at the same time put my feelings, to the side
Hmm.
and have to be present to inform all of her patients and help them with referrals and take care of so many things that I
No.
can say more about in a minute. But the process of doing that while grieving and having my own full-time practice and young children and all of those things was really excruciating. So then I wrote a paper to try to process my grief about that and got.
What was the paper called? What was it? This, what was the topic?
Sure. So it uh, was called, I don't know if I'll even get it exactly right anymore,
Okay.
but professional wills, and it was grief and the dismantling of a practice as the practice executor.
Okay.
So it was really trying to convey, I'm a, psychodynamic and relationally oriented therapist. So was my friend. From that perspective, we looked at grief and the loss of the attachment, therapeutic relationship as a potential trauma for each
Hmm.
patient that was going to be told, this person you've relied on for however long, you're not going to see them again. It was that abrupt, that drastic, and the consequences were really devastating. And then how to handle what people were going through and provide for them became, the mission, and became the preoccupation for my friend of her remaining weeks. It was
Mm.
very short, but her being alive for those weeks really informed and taught me about what needs to happen, because she was there saying, this is what I want you to do. And this is what this patient needs. And this is what that patient needs. And here's how I want you to handle this. And so it became this really detailed, comprehensive way of assuming kind of the needs of all of these patients very differently than from what I think typically happens, even if someone has named a professional executor, and especially if they haven't, where a colleague puts a note on your door and says, X therapist is not available, call Dr. So and so for
Hmm.
information. And then they might call and they might be, oh, I'm sorry to tell you this happened. And here's a list of 10 referrals. Good luck. That's
Right.
really minimum. That's what happens, I think, a lot of times for patients. And I had the experience of, way before this even happened with my friend, of telling someone. I had seen an obituary of a colleague who had passed away, and I knew one of my own patient's fathers saw this colleague for therapy, and he had told me how amazing the therapist was and how
Mm.
wonderful. And I didn't know if he knew about it. And so that was my very first entree, where I called him and said, this isn't about your son. You don't need to worry, but I have something to share with you. And I
Hmm.
informed him, and he said he had gone to the office the week before, saw a note on the door, never called the person because he thought, oh, she's
Right.
just got an emergency. I'll go again. And my telling him, he was obviously devastated, sobbing on the phone, talking about what an amazing, amazing impact this person had had on his life. So I had that experience before my
I
friend
see.
Kim passed. And then I had her teaching me what I needed to do,
Oh
and
my
which was
God.
like the opposite end of
Yeah,
things.
yeah, yeah.
Oh,
Let me jump in here. So you use the word executor. Is the executor in this context the person who manages the clients or takes over and begins to see the clients?
no. So the executor is the person who fulfills the wishes of the therapist. The therapist sets in a professional will um, what they want done, how they want their patients notified, who they might be referred to,
I see.
where you're going to find the access information to get your patient's contact information, where your records are kept, how you do your billing, all the details of a practice. And you name typically a colleague. An attorney will tell you this could be that an administrative person. Sometimes people leave it to a family member, but our ethical code is to leave it with someone who is qualified not only to interact with your patients directly in a clinically oriented manner, but also qualified in being aware of the ethical obligations and the legal obligations around confidentiality and the security of medical records and compliance of all of that personal health information. So really, it needs to be a colleague at minimum, who then steps in to fulfill your wishes. And that does not mean taking on your caseload. It's
Okay.
impossible to take on
Okay. So
someone
two
else's.
separate things. Okay. Let me just remind everyone I'm speaking with Dr. Robyn Miller. She's the founder of TheraClosure. the first therapist professional executor service. Okay, so um, man, this is intense. I mean, there's no two ways about it. And your experience in particular sounds very intense. Was it after that that you founded TheraClosure? Talk to us a little bit about that, and then let's get into the specifics of what you do there.
Sure. No, it took me a while to get here. I did this for my one friend, and then sadly, I had to do it a second time for another friend who had a crisis. And I stepped in to do this for her practice. She thankfully returned to her practice a number of months later, but in the meantime, I had that as well. And so then I started doing trainings. And when I did
Oh,
trainings,
wow.
like the Maryland Psychological Association last fall or last winter, the reactions I got for people were like, whoa, you are stressing me out here. I never thought about this. I never heard about that. Or the
Right.
person that I named, 20 years ago has since retired. I don't have close enough colleagues to ask to do this. People were so overwhelmed. And so that was the spark from starting TheraClosure. I was like, we need a better solution to this problem. People don't know what to do, and that's why they don't do it. So that was my inspiration.
Now, is this specifically for if a therapist is going dies, or is it if they leave and have to just leave the profession?
So it is for incapacitation or deaths.
Incapacitation. Okay.
If something were to happen to you, severe enough, tragic enough, that you don't have, at minimum, kind of the mental faculties to call yourself to your colleague and
Okay.
say, hey, I need coverage because I got to take a month off. If you can do that, then you got to do that.
Okay.
If you can't do that because something terrible has happened and you are distraught and unable to function in the therapeutic role, or if it's a physical incapacitation or death, you are not able to be your psychological professional self. Then that is when a personal representative, someone that you name to notify us, would contact us and tell us something happened to you. And then we would step in to take care of everything that you have already communicated to us that you would want done for your
Okay.
patient.
So you folks are acting as that person or that. Okay. Okay.
We take that on so that you
I see.
don't have to ask a colleague, make this awkward arrangement with a colleague. Sometimes people pay their colleagues, but the problem with that is colleagues think, it'll take 2 or 3 hours to, wrap up somebody's practice. It's so overwhelming it takes multiple hours per patient. You're going to
Okay.
talk to them many times. You're going to have hours of, searching for available therapists who will be good matches for these people. Think how hard it is these days to find a referral for
Right.
just
Right. Right.
one, for just
Wow.
yourself. You have to, so all of this, it takes hours and hours and hours. And if you name a colleague and if you say, oh, my estate will pay you your hourly rate to take care of this, for a practice of 20 patients a week, plus, your records for all your past patients, a an estate could end up with a $10,000 bill completely unexpected
No.
if the arrangement was my estate will pay my colleague to do this. The other is, either it's voluntary, which mine was, and my heart was happy to, be able to be of use to my friends and do this for them was in many ways a privilege, but it also was a tremendous heartbreak and burden at the same time that I wouldn't wish on anyone. So I've learned through this process that it's really not the best
Mhm.
idea to have a close colleague do this for you. And that it's really something we have not as a field figured out how to make more efficient, cost effective, palatable even for therapists to take care of this. So during the pandemic and after, when so many of us switched to electronic health records, You no longer need it to be your colleague who's in the office next door to go into
Mhm.
your office and find your paper calendar and see who you're supposed to see and get the paper records. We now have the possibility of outsourcing this like we do with so many other parts of practice. So that's where the idea came. Like, this doesn't need to be someone who's going to be in the throes of grief themselves and
Mhm.
overburdened. This can be someone who, we certainly don't want it to be a stranger. We don't want it to be totally a corporate, impersonal thing.
Right.
But the model that I have developed is we people who want to make this much easier on themselves and cross off, because I think a lot of people, the feedback I've gotten is, I know I should do it. I know I mean
Mhm.
to keep intending to. I'm just putting it off. I don't, all of that. In order to solve that and unburden yourself of that weight that so many people carry, we have created the system where if you want to sign up, we meet for a really intensive consultation where we try to get to know you and your practice and how you work, what your orientation is, what kind of patients you see them, how you interact with them, your general style. We want to get to know the details of how you run your practice,
Wow.
where your records are, how you keep your schedule, and then we come up with you with a personalized plan of, if something happened to you, how would we access that, like, immediately, so we could reach out immediately to your current patients and let them know in as sensitive and caring a way as possible, that you would not want the end to be this way, and
Mhm.
that you have put together a really caring and compassionate plan for how to take care of your practice and your patients in the event of the unexpected, which sadly has happened,
Mhm.
if we're making this phone call to people. Um,
Robyn, excuse me. So
yeah.
who is this for?
It is for all therapists of all disciplines, social workers, licensed marriage and family therapists, counselors, psychologists. It's for psychiatrists too, but for their psychotherapy patients in particular. All across the disciplines, therapists have this ethical obligation. If you go and look in your ethics code, you're going to find it there, even though you probably don't remember ever having heard
Mhm.
about it or talked about it. It's there.
So
And
more than something that's nice to do, nice to have checked off, as a therapist, you're ethically responsible
yes,
to take care of this, to manage this.
you are.
Wow.
And that is to help um, mitigate the effects of traumatic loss on vulnerable people who rely on us and trust us, going back to the start of our conversation, that really intimate, you know meaningful relationship. And for so many people with trauma, what you're working on in therapy is the attachment relationship. And can you ever feel secure with
Mhm.
someone? Can you ever feel safe? Can you ever be yourself? Are you going to be rejected or abandoned or harmed? And so, of course, the loss of a therapist in a tragic and sudden means is going to be painful. I mean, there's no way around that. I can't prevent that, and nobody can. But you can mitigate that loss by communicating to the patient, as I did for my friend Kim. I would call after call to these people and say, I am the psychologist covering for Kim's practice. I have some really upsetting news I need to talk with you about. Are you in a private place? Do you have supports available to you? Kim
Mhm.
wishes she could tell you this herself, but she is unable. She has been diagnosed with. And then people decide. My friend wanted it to be excruciatingly plain and direct. So she wanted me to say she's diagnosed with terminal pancreatic cancer and she is unable to be available to her patients anymore.
Mm,
That's what she wanted. Other people will want something different, but
right.
it's communicating to people, then your therapist not only is not available to you, and that's really sad, and I'm here to kind of help you through this immediate reaction and shock and help you with resources so that you're not falling through the cracks. That's really the intent. But also, the important part of approaching it this way is to preserve the new secure attachment or the therapeutic alliance, whatever you want to
Hmm.
call it, as best as possible so that it is a loss no matter what we do, but it doesn't necessarily have to be an abandonment. It doesn't have to be a trauma.
Hmm.
And it can be a loss where people understand, wow, my therapist really cared about me. They did everything in their power
Hmm.
to make sure that someone would be there to help me if they were not able to be there for me. And
You're
I
not
think,
only managing the incredible, obvious traumatic emotional aspect of this, but also the logistics, which have to be handled, the nuts and bolts of okay, how do we move on from here? Um, there are these referrals. Yeah, wow. I
it's
mean,
a
I
lot.
as first of all, as you were talking and you're talking about your own experience with your friend, I was thinking, okay, how common is this? But then you were like, and then it happened again. So, and you can, I mean, I can see why a lot of people don't even want to go near. This is hard stuff to do. Even trauma in and of itself, people don't want to talk about. But this is like you're talking about your own incapacitation. You could see what people don't, they want to avoid this.
People want to avoid it. And I've been presenting recently at psych associations and trying to tell people about TheraClosure, this new option, this new way to say, hey, I'm going to spend an hour and a half and I'm going to spend a little money. It's a subscription service. I'm going to spend maybe 2 sessions worth of my pay a year to have and an hour and a half of my time only once to be able to outsource this whole thing and know I did the right thing for my patients, for my family, nobody, for my colleagues, otherwise families are the ones fielding the questions around, wait, where are my records and how do I find things? And patients are showing up in the waiting room and your colleagues have to tell them that something happened to you.
Mm.
And I spoke with a psychologist just this past weekend who told me that 25 years ago, her therapist died and she was not notified for 2 months after she had gone repeatedly to the door for her sessions, banging, trying
No.
to find out where
Oh
is she.
man.
And 25 years later, she's still accessing the emotion of that, both the anger and the hurt in feeling abandoned, and now wants to do everything she can to be sure that that never happens to her own patients. So
When
it
when
so
someone contacts you, a prospective client of the service contacts you, um, and after the initial information gathering, how and to what degree are they in touch with you? You mentioned the service or subscription rather.
yeah, sure. So what we do is we create a will, very personalized, as I said. We figure out with you what makes sense for your practice and how we're going to do it. And we document that, and it's been legally approved and reviewed. We have a template, and we make sure everything is in accordance with the regulations of each state regarding record retention and notification requirements and so forth. And you sign that will, and you notify your personal representative that you want us to do this thing, and they're in charge of if something ever happens, letting us know. We have different ways of different options around how we would access your information. We have a password manager option that you can use to, allow us access only in the event of an emergency. We don't want access to your private
Hmm.
things any other time. And then we're on call essentially. And we don't, um, we send you reminders a couple times a year to update any information. You can leave, part of the conversation is, do you want to leave specific instructions for particular patients? You know,
Mhm.
we all know the folks who would really struggle the most and be
Right.
most risk if something were to happen. Do you have a special plan for them? Do they need to be notified in a certain way? Are they going to be at risk for harm to self? Does the person calling them need to have other backup in place already before you notify them? You can update that information as your caseload changes, as you know, you maybe your colleagues and uh, change. We can refer patients to people you choose. We can find referrals ourselves. Usually people will say, I want you to call my friend and see if they could take one of my patients. But if they can't because they're too busy, then you find someone. We take on that responsibility. We notify your licensing board, your malpractice insurance. We take custody of the records and notify all your past patients so that if they're looking for their records and they
Wow.
find practice is closed,
Yeah.
they know where to go to get their records. I mean, we take care of all of that, and there's no additional cost to the estate. So your estate is not going to wake up one day and have a $10,000 bill. You are taking care of that in your planning by paying the modest
Mhm.
fee each year to keep us on retainer. And it is a gamble. I mean, for any one of us, generally healthy folks is in our 40s and 50s, it's maybe like 1 in 1,000 that this is going to
Mhm.
happen to. But I can tell you it happened to two of my healthy female friends in their 40s.
Oh my
Um,
God.
and so, you know, you just want to do the right thing and want
Right.
to be relieved of that burden.
Yeah. 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 Wow. Like I said, I haven't spoken with anyone else on this podcast about this topic, and you're the only person I know who's doing this. But I'm glad you're doing it. You're obviously someone who's very compassionate and invested in this work. Robyn, how do people get in touch with you and learn more about this?
Thanks. Yeah, please come and find us and read a whole lot about us on theraclosure.com. That is the best way. You can find me on LinkedIn, but checking out our website, we offer a free informational meeting to talk with you about how and whether we can be helpful. And then, you know, there's also the option of enrolling and securing this care with such minimal effort on your part. We know nobody wants to think about it, but you can do it for an hour and a half. You can face this and really feel like you and know, because ethics is so important in our field, and we all train so hard and invest so much in
Right.
doing the right thing by our patients. Here's one more thing. Don't forget.
We'll have this linked up here at the show notes page at the traumatherapistpodcast.com. Once again, that's theraclosure.com. Um, Robyn, thank you. Love to have you back at a later date, talk more. I really appreciate you being here.
Thanks so much. I'd love to
Uh,
tell you. There's so much people need to know, but thank you.
Okay. Take care.
Okay, bye-bye.